Hello, listeners. Welcome to the first Linde Engineering India podcast. My name is Chitra Parmar, and I'm happy to be your host today. Have you ever wondered about how oxygen is produced? With me is Apurva Fanse from Plant Components and QA/QC, who will tell us more about the topic. Apurva is also Linde Engineering designated Oxygen Competent Person at LEI. So let's start with the basics of oxygen. Nowadays, we hear a lot about oxygen requirement for medical use. Apurva, could you tell us how oxygen is produced?
Oxygen is produced by air separation technology. The most common process is pressure swing absorption, commonly known as PSA. But there are also other technologies like VPSA, that is vacuum pressure swing absorption, membrane technology, and cryogenic distillation process. So in simple terms, air is sucked from the atmosphere and its primary components like nitrogen, oxygen, and if required, argon and other trace gases are separated from the air.
Wow, that's great technology. Apurva, is oxygen flammable?
See, oxygen is not flammable in itself, but it supports combustion. It can react with most materials. So, when the oxygen purity and concentration is more, or the pressure is more, it will lead to more vigorous combustion. Moreover, the presence of pure oxygen will lower the ignition temperature up to the ignition of the materials that normally do not burn in atmospheric air. So, if there is ignition, then in the oxygen enriched atmosphere, the burn rate and the heat release will increase several times more than in normal atmospheric air.
Thank you for that information. So, my next question is it risky to store and transport oxygen? And what precautions do we need to take?
As I said earlier, oxygen is not flammable, but it supports combustion. Therefore, oxygen is listed under hazardous substance category for transportation as well as for storage. So in simple words, yes, it is risky to store and transport oxygen. Hence, we need to take precautions like the pipe carrying oxygen and the oxygen storage tank needs to be absolutely clean. The surface which comes in contact with oxygen should be free from any form of hydrocarbons like oil and grease because even a small amount of heat generated due to friction inside the wall body or due to adiabatic compression at the elbow, it can lead to ignition and eventually explosion.
That is vital information. Thank you for sharing, Apurva. What happens when oxygen is leaked?
If small amount of oxygen is leaked in open space, it may not harm anybody and nothing will happen. But if the same amount of oxygen is leaked in a confined space or say in a closed room or in a large quantity of oxygen is leaked from an oxygen storage tank or from transport tanker, it may lead to oxygen cloud formation or oxygen concentration in the surrounding area. And if there is any ignition source, it may lead to explosion. This may cause damage to the property and even fatality. Moreover, the most important is liquid oxygen can also cause severe cold burns. So leakage of oxygen must be avoided.
Well, there is this frequently asked question: is medical oxygen different from industrial oxygen?
Both oxygen are more or less same, but the only difference is that for medical use, the moisture and impurities are removed or controlled. So for medical use, the purity of oxygen is around, you can say 95%, whereas for industrial use, 92% purity is good enough. However, there are instances when due to medical emergency, industrial oxygen has also been used to save life. Only in few critical cases, depending on the patient's condition and age, it may be necessary to use high purity oxygen exclusively produced for medical use, which may have purity as high as 99%.
Speaking of purity, Apurva, could you tell us, can people breathe pure oxygen? And are the patients in the hospitals administered 100% oxygen?
The answer can be yes as well as no. Yes, we can breathe pure oxygen, but only for a short time. Prolonged inhalation of pure oxygen can damage the lungs and can cause oxygen toxicity or hyperoxia, which can be fatal.
We know that for the treatment of COVID-19 infection, majority of patients require oxygen support in the hospital. You have informed earlier that inhaling pure oxygen is harmful. So how much oxygen is given to the patients?
Usually in hospital for clinical use or for the treatment of COVID patient, maximum 50 to 60% of oxygen is given through the mask for breathing. The oxygen purity can be as high as maybe 95%, or even if it is a little bit up and down, it's not a problem. But along with oxygen, air is also supplied to maintain the fraction of inspired oxygen, commonly known as FiO2, to be zero point 0.5, which means 50% pure oxygen. So normally patients are not administered pure oxygen.
Thank you, Apurva, for sharing all these insights with us today, and to our listeners for joining.
Thank you for inviting me for the podcast.
Thanks, everyone. Stay tuned for the upcoming podcast. Goodbye.